and on behalf of the Theosophical Society and on my personal behalf, I welcome you all to the 31st session of this series of talks organized under the theme of Wisdom for Living. It was in September 2022 when this humble yet profound initiative was started under the guidance of our President, Mr. Tim Boyd, implemented by Mr. Ram Kumar month after month, when in September 22, first talk was organized. And since then, we have speakers from different walks of life. Although the first talk was by Swami Abhedanandji on spiritual ideals, on how to handle stress. But apart from that, we have had speakers from the field of arts, astrology, medicine, humor, and even latest, the last talk was from the field of someone related to films and plays. So that's what was the purpose of this series. That wisdom is not only to be found in monasteries. There are people around us living a normal household life, doing their duties in their professions, but they have found some ways to put the wisdom in their life, in their professions. And all those speakers shared their experiences and insights, not only with the people in person here, but also those who watched it online. And all of this is done with a approach, with the thought of spreading this awareness that in this world that is governed primarily by mind and all its modifications in the forms of selfishness, greed, competition, conditionings, there is an alternate way of living. The alternate way of living which is in harmony with the natural order of things. And when the way of living is in the natural order of things, then that peace, that bliss that all of us wants to have in their life, that automatically comes, not only at the individual level, but also at the global level. And the necessity of this initiative was felt. And at that point, when, everyone at some point of time in their life, without an exception, observes life with its challenges, struggles, and the current world scenario where stress is the epidemic of 21st century, everyone ponders things. Is there another way of living? Is there another way of approach to life? And some are fortunate to find those avenues. Others remain contented with some superficial solutions, temporary solutions. But we all know that until and unless the root cause of the problem is addressed, the solution is not lasting. And what is the root cause of any form of suffering? If we take a word from ageless wisdom, that is ignorance in any and every form. Ignorance about oneself, ignorance about the surroundings, ignorance in the relationships, the true nature of relationships. And the light that dispels this darkness of ignorance is often termed as wisdom. And in a way, this initiative, Wisdom for Living, is kind of a duty that is incumbent on the Theosophical Society because of the mission statement that Theosophical Society has. The mission of the Theosophical Society, I think many of us may know, but for those who do not, it says to serve humanity by cultivating an ever deepening understanding and realization of spiritual self transformation, study of ageless wisdom, and unity of all life. So, the first three words, to serve humanity. And there can be various avenues of serving humanity by charity, by giving food, by giving material help, which is also done by Theosophical Society's branch, which we know as Theosophical Order of Service. But through Theosophical Society, the avenue is very clear to work on the psyche of the consciousness of human beings, to improve that. And so that's why this humble yet profound initiative, Wisdom for Living, was started almost 3 years ago, and it's very successfully going on, and every time we see more and more different people coming to attend those sessions. Those who have missed earlier sessions can watch it on YouTube channel of Theosophical Society Adyar. And along the same lines, today we are going to focus on a very interesting subject: perspectives on well-being and public health. Because if you have seen the gradual evolution of health, now it is no more health is no more absence of sickness. It is something called well-being, which covers not only the physical health or absence of sickness in physical body, but also the well-being of our emotional, our mental and spiritual aspect of existence. And we are fortunate to have among us today Dr. N. Karikalan, who heads the Department of Social and Behavioral Research at Indian Council of Medical Research, National Institute of Research in Tuberculosis, which is one of India's premier health research institutes. His work highlights the human side of illness, showing how tuberculosis and HIV are shaped not only by biology, but also by people's social, economic, and behavioral circumstances. With training in public health, Dr. N. Karikalan uses a wide range of research approaches: surveys, in-depth interviews, cost-effectiveness modeling, and social network analysis to understand the barriers that patients suffering from tuberculosis or HIV face in accessing care and completing treatment. Over his career, he has contributed to national and international funded projects addressing alcohol use, depression, stigma, hardships, and delays in care seeking. Challenges that often prevent successful treatment. Patients start, but due to all these reasons, somehow they are not able to complete the treatment, particularly among vulnerable groups such as migrant workers. Equally important, his research seeks solutions. He contributed to one of the first studies in India demonstrating that psychosocial counseling could improve tuberculosis outcomes for patients with alcohol use disorder. He has examined the role of women's self-help groups in spreading awareness and prevention, documented the emotional toll of drug-resistant tuberculosis on patients and caregivers, and developed tools to measure the quality of tuberculosis care across public research. Dr. N. Karikalan has coordinated clinical trials, multi-center operational studies, community-based interventions, ensuring high standards of ethics, teamwork. He also serves as assistant coordinator of Regional Resource Hub for Health Technology Assessment in India, Tamil Nadu. And at the heart of his work lies a clear conviction that I can assume science must not only generate knowledge but also make healthcare more responsive, compassionate, and effective for those who need it most. So I invite Dr. N Karikalan to share his views on perspectives on well-being and public health. Dr. Karikalan, please.
Very good afternoon. Thank you for the invitation to attend this important lecture, and thank you for the nice introduction, sir. So myself, Dr. Karikalan, and I'm an Ayush doctor. I think many must have known about what is meant by Ayush. And then I have done my master's in public health, and I'm a doctoral scholar, and I have completed my PhD in public health. And I have been associated with the Indian Council of Medical Research for the past 15 years, with a focus on HIV and TB and COVID, and also mental health. So this topic is something which is very near and dear to my heart, public health. Not because I have done my PhD in public health, not because I am a researcher, not because just I am a scientist. I want to talk this topic often with maximum people possible, especially after the post-COVID era. I think everyone must have understood what is the importance of public health after we went through what COVID has caused in 2020 and 2021. I think many people were brought into the thinking of public health by COVID. That was one of the benefit which COVID has brought to the society. We were all very individualistic before pre-COVID. Everyone was willing, everyone was thinking that we are safe unless we are following proper hygienic practices, we eat well, we do exercise. But COVID has brought to a situation no one is safe unless everyone is safe. Then we started thinking about public health. And we have a very equally challenging, pressing public health problems in the world. Climate change is drastically changing the environment in which we are living. And as a responsible citizen and as a responsible father of a kid, I want to speak more about public health with more people. In India, we have a certain attitude. We Indians give the utmost importance to education. We are very clear about what our sons want to do, what our children want to do. We always debate about which is the school our children have to study, which is the university they have to go, where they can go. Public education or education in general is a very aspiring thing for our Indians. But when it comes for public health, we are least concerned. We always think about, just it is a matter of, we should not be following any risk factors, and, if we can grow up our children in if you give a nutritious food and then if you teach them simple things, that is enough. Our understanding of the importance of public health is very limited. So I think this kind of opportunities, these kind of lectures will help people to understand why we have to take serious about public health. We have to take serious about public health just like we are taking care of the education of our children. We are taking care of we give a lot of importance for how we vote. We give a lot of importance for how our children study. We give a lot of importance for many other things, the cinema, the art and culture. But such a thing we are not giving for public health. It is the most important thing which will be our understanding of public health, the belief we are having in our public health system that will decide on a lot of things in the coming decades. It is going to be very important. So I will take this opportunity to just provide a glimpse of why it is important. So everyone knows about what is well-being, individual well-being and public health. So what are some of the benchmarks for a well-being? How can you say a man is or a woman is healthy? We will say he is able to speak, he is able to walk, he doesn't have diabetes, she doesn't have hypertension, she doesn't have cancer. These are some of the benchmarks of he lived for 70 or 80 years. So these are the general benchmarks we put towards what is meant by individual well-being. How a community's well-being is measured. We always think about individual well-being. How can we measure, how can we understand a community or a society or a nation is healthy? And that science is called as public health. Public health makes you understand how a society should be, whether it is healthy, whether a society is functioning well. That is the science of public health. Today we will talk between the intersection of individual well-being and public health. These things are becoming more and more intertwined. There was a time that when you are individually well, then you are mostly safe. But now we are living in a time that unless you take care of your public health environment, you cannot be safe at all. You cannot be healthy at all. So you know that there are different ways of looking into health. I think many of you are well learned. I was very surprised to see that our sir was having more knowledge than a doctor like me. I was just talking for 10 minutes with our ex-DGP sir. Many of you have learned. I think some of the things may be not new for you, but just I will try to recap. There are different ways of looking into how health is viewed. The very predominant view of what is meant by health is the biomedical approach. So this approach has started in the 17th or 18th century with the evolution of modern medicine. That is the biomedical perspective. Health is something which is viewed as absence of disease. If you are not having any disease, then you are considered healthy. That is the materialistic concept. That is the biomedical concept. It was very successful. This biomedical concept is something which has saved millions of lives, but it also has its own limitations. It just focuses on whether you are having a germ, whether you are having any metabolic disorder. It is quite objective, quite measurable. Then you are healthy. That is the term which we have been using at least till 1970s and 80s. And there is a concept called as ecological concept of health, where you don't look into only the person whether he is having a disease or not, but also you look into the surroundings. For example, TB. TB is one of the most important public health problem of the world. Before 100 years, 1 in 7 person in 18th and 19th century, 1 in 7 person in the world died of tuberculosis. Then the role of the environment comes. Whether you are living in a crowded city, whether you are living in a rural village, your ecology or the environment decides a lot of factors. What kind of physical environment you are living. It is polluted, it is having a good drinking water, it is having a good sanitation thing. All these things these are the products of the 18th and 19th century. How your physical environment is shaping public health. That is called as the ecological concept. Then after some 1970s or 80s, it was a bit democratized. Psychosocial concept. It is not just the germs, it is not the physical environment, it is also about the social world which you are living. The family, the peer support, your mental health, all these things are equally important as compared to whether you are having a germ or not, whether you are living in a very good environment or not. That is called as the social environment. That is the psychosocial concept of health. So all these things have evolved in the past more than 1 century. Now we are entering into the holistic concept, where each and everything plays a very important role. You have to see that biomedically you are clear. You have to see that your physical environment is helping, supporting you, and also your psychosocial support is helping you to be healthy. That is the holistic concept. You cannot leave all the three things. Biomedically, psychosocially, as well as your physical environment has to be taken care if an individual or a community has to live in a healthy way. That is the holistic concept of health, which we are discussing more and more, especially post the pandemic. So to give two good definitions, that is the very good popular definition of WHO. Health is more than the absence of disease. It is about well-being, equity, and participation. So this is a kind of a holistic and a comprehensive definition given by WHO. And if you look into the next two definitions, public health is the science and art of preventing disease, prolonging life, and promoting health through organized efforts of the society. This is one of the classic definition for public health. There you are seeing three important things. One is prevention. Preventing disease, prolonging life, and promoting health. All these three components are very important for saving your individual health or your society's health. You have to prevent diseases, you have to prolong the life, as well as you have to promote healthiness. So initially I told you, if you want to measure an individual's health, there are certain parameters. I don't have sugar, I don't have BP, I don't have cancer, I walk nicely 5,000 steps, then you are healthy. How we measure a public health status of a country? How we measure a society is healthy? So there are some three parameters. One is the life expectancy or the lifespan. When we get our independence in 1947, the annual life expectancy, the average life expectancy of an individual was just 30 years. A child which is born in 1947, he or she is expected to live only 30 years. In 2025, our life expectancy is 69. Throughout the world, we have seen a great increase of life expectancy and lifespan. Average, I am saying. We should not be thinking about, oh, my great-grandfather has lived for 100 years, fine. But on an average, the life expectancy increased only after 1940s. It has been increasing gradually across the world. India has reached 69.
I'm sorry to interrupt.
Yeah.
Is it mainly because of fall of child mortality or it is?
Yes, sir, I'm coming, sir. Next. So this is one thing, lifespan. And the next two indicators to say that maternal mortality. Maternal mortality in the sense, if a mother is giving birth to a child, then she is expected to live after 48 days. The first 48 days of post-pregnancy is very important. Maternal mortality has been very high throughout the world till 1940s and 50s. In India, till now we have, for example, you must have seen a news that Kerala has achieved a maternal mortality rate of 5 per lakh. Just 5 mothers. It is even tragic. 5 mothers die out of 1 lakh population in Kerala, which is less than the US maternal mortality, which is 6 per lakh. Kerala has achieved it. Tamil Nadu is having, I think, almost 10 or 12 is the maternal mortality. But still there are parts in India like Assam and UP where they have maternal mortality up to 100 or 200. Even before 10 years, in Assam we had a maternal mortality of more than 500 and 600. So maternal mortality is one indicator which says that whether a society is healthy or not. And next one is, like Sir told, infant mortality. If a child is born today, how much likely the child will be able to survive the first birthday? That is IMR, we will say. So all these three, your life expectancy is dependent on your infant mortality as well as your mother's life expectancy. If these three indicators are good, then a society is considered basically it is having a good system. It is having a good public health system. It is saving its mother, it is saving its children's, and if your children's are saved, the average life expectancy of the nation increases. So we have achieved a lot in the past 60 years. From 30, we have reached almost 69, but still we are far below. When you take the life expectancy of Japan, it is 88 or 89, the average life expectancy. That is the reason we are having more chronic diseases. When you age, you also get more chronic diseases. That is different part of a problem. But a society always should try to attain lowest infant mortality, lowest maternal mortality, as well as the life expectancy has to be improved. That is the way we measure public health. These are the three indicators. And there is another one important indicator. Our Director General used to say, because I am working in TB, he said one time, very nice thing, if India needs to be a developed country, India should get rid of TB. When a society has TB, tuberculosis, then we cannot say that society is a developed society. TB is not just one another infectious disease. Tuberculosis, I will be taking a small presentation on that separately. TB is an outcome of the gross social inequality. TB is a disease of poverty. When there is poverty, when there is social inequality, then TB prevalence will be high. Unless you adjust, unless you equalize the social inequality, TB cannot be eliminated. That is how TB was eliminated in Western countries. TB is still more prevalent. India has the highest prevalence of TB even now because we have enough medicines, we have free medicines, we have best diagnosis, everything, but still TB is prevalent is the social determinants. Okay? So public health is measured in this way. Your infant mortality, your maternal mortality, as well as your tuberculosis, as well as your life expectancy. This is the way we see what is meant by public health. So if you look into the prevention, prolonging and promoting health, all these things are required to improve your life expectancy. And third definition, this is one of there is no author for the definition. I just use it from the internet sources. All the things which I am presenting are from internet that I have to disclaim. Health is created. This is something which we have to inculcate more in the minds of kids. Health is created where people live, love and work and play, not just in hospitals. This is something we have to inculcate, just like we are teaching our children they have to go for IIT and JEE and UPSC. This is right time we have to start inculcating this kind of attitude in them. Your health is created not in hospitals. It is where you live, where you love, where you play and work. Unless you normalize all these four domains, your love, live, play and work, our generation will not be healthy. That is the thing which I will be explaining in the next few slides. These are technical. So, how our health is decided by where we live. Let us take Chennai. So, these slides, I am just using it as a guide. This is a scientific slide. I don't want to give more statistics and bore you. Just you can look into the title and then I will give some examples to understand why our place of living is very important. As I told, India has the highest TB prevalence in the country, in the world. Every year we have 1 million TB cases across the world. 10 million TB cases across the world. Out of that, some 2 to 3 million cases occur in India. 25% of TB cases occur in India. Tamil Nadu has some, every year we diagnose almost some 90,000 to 1 lakh TB cases. 90,000 to 1 lakh every year we are diagnosing. And Chennai has almost 11 to 12% of the TB cases. Chennai almost diagnosed more than almost 10 to, you could say that around 10,000 cases are diagnosed every year. And in Chennai has 3 districts, North Chennai, Central Chennai and South Chennai. I think this falls under Central Chennai, I think Adayar falls. So if you look into the TB prevalence, majority of the cases, TB cases will occur only in North Chennai and Central Chennai. The South will not be affected much by TB. The same Chennai, the same population, the same culture, but why the disease prevalence is so high in North Chennai and Central Chennai when compared to South Chennai? The environment matters. I think some of you might have went to the slums of North Chennai, like Vyasarpadi or Puliyandop or some other places, and you look into the pristine environment which we are sitting. Within a radius of some 20 to 30 kilometers, we are having a vast difference. India is such a diverse country, they say that every 30 kilometers you see diversity. Every 30 kilometers you see a diversity of your environment, you see a diversity of food, you see a diversity of culture, you see a diversity of language. The language which is spoken in Chennai will be very different from the language we speak in Dindivanam or outside. India is a very, very diverse country. So environment matters here. I said, North Chennai is so crowded. It is the most polluted area and it has a very high TB prevalence. It is also having a highest level of substance use. Poverty is there. Violence is very high there. But when you look into South Chennai, comparatively everything is very low. Let us take, this is another way of looking into it. For example, TB. South Chennai, this is a pristine environment. TB spreads in polluted air where you have a lot of air congestion, where there is no space for breathing. TB is spreading. But that cannot be the only determinant. This place may be not, this place may be free from TB. We have done some studies in Northeast. Just we are completing a study in Manipur. The most pristine environment. We have done studies in Madhya Pradesh, tribal areas. The most pristine forest. Among the tribals, even in Andaman, TB is very high. Not because they are living in a forest, not because they are living in a very green mountain, you are protected from TB. The reason is, even though those tribals are living in a very very natural environment, their nutritional level is very poor. Malnutrition is very, very high among tribal population. And malnutrition is a very important predictor for TB. And when you look into the household, the house in which the tribals are living in Madhya Pradesh, you will be shocked to see. They will be having one floor, ground floor, it is a hut. In the ground floor, below you will have cattle and people will be living on the top. There will be no windows in the households. So even though they are living in a very green forest, even though they are very pristine, their household is of such a character where the air transmission is very rampant within them. So that is the way our environment works. If you go into Mumbai, Mumbai and Delhi has the highest prevalence of TB. They have built all these multi-story, they have made these slum redevelopment projects where they built multiple stories of, resettlement for them. Those are the packets of transmission. They built the households in such a way within 400 meters, 3 or 4 people have to live in a multi-storied building. Because they have transformed the slum into some kind of multi-storied building, you are not protecting them. You are actually enabling the transmission of disease. So where we live, whether you are living in an urban area, whether you are living in a tribal area, whether we are living in a rural area, that determines not only the transmission of disease, also your access. In Chennai, we have so many hospitals. I went for a district called as Senapati in Manipur. It is a district where the particularly vulnerable tribals, PVTGs, they reside in big area. It takes almost 2 hours to reach from one village to another village. Just if you want to cover some 3 to 5 kilometers, you have to travel for almost 2 hours. If you want to come to the district hospital, if you come by walk, it will take a whole day. It is all mountain, the terrains. Then I realized what kind of privileged environment we are living when you compare to Northeast. That is the case in the central India, in Jharkhand and Chhattisgarh. Your accessibility matters. It is very easy for a person to just reach Stanley or MMC, just to take an electric train, just to go by metro or just pick a Ola. That is not the case everywhere in India. So the place where you live determines a lot. Your environment, physical environment determines a lot how your health is impacted. You may be a well-educated person, you may be a well-conscious person about your health, but your area where you are living, your physical environment determines a lot of things. That is the reason we have to invest a lot in our surroundings, our physical surroundings. Next, this is another one most important thing. Your health is affected by your social environment, where people love. One strange thing, India is having the highest number of TB cases, as well as India is the country with the highest suicides in the world. When you take suicide only, India is the highest number of suicides. What could be the reason? Sir?
Joblessness.
Yeah, joblessness. Yeah, maybe one thing.
Poverty.
Loneliness.
No, but what is the comparison per lakh? Because population of India is also so high.
Yeah. So even with rate, we are having high, sir. Even with rate. Reason in India, that loneliness is a very important thing. In India, we have not understood the importance of mental health. We are not recognizing that depression is a problem. We are not recognizing anxiety is a problem. We are not recognizing stress is a problem. We take it for granted that these are normal things. In India, we have a very poor health-seeking behavior. Only when you become so immobile that you are unable to do any work, then you consider it as illness. Unless otherwise you take it everything for granted. Even with TB, even with HIV, even with diabetes. Unless the person is well educated, people will not access for care. Unless you become physically immobile, then only they will seek care. And when it comes for mental health, it takes a very long time. It is not like a germ. Mental health builds within yourself. The stress builds within yourself. We normalize mental health problem. That is the reason even measurement of mental health problems in India is very low. We don't frequently, now only we started some kind of surveys in ICMR. We are trying to measure depression. We are trying to measure anxiety and everything. We thought that mental health doesn't exist. Now only the realization is coming. That is one reason more and more people are, lacking mental health support here. When you don't measure mental health, you lack mental health support. India has the lowest psychiatrists in the world. For the population of 1.3 billion, we have very few thousand of psychiatrists. We don't have good professional counselors. People don't seek, and then you don't give the support also for them. That is the reason, that is the indication it is showing your suicides are also increasing. If you go for even a small country in Western or Eastern Europe or United States, there they will have a therapy support for even a small anxiety problem for a child. Here we stigmatize mental health. If you say that I want for a counselor, how many of you can boldly say that I need a counseling support to your family people? We cannot say. That culture is not there. If I say that I feel so depressed, I want to go for a counselor, a therapy, then you will not be looked normal within your friends. They think you are weak, he is having some problem. It is not normalized so far. That is the reason we are seeing these adverse reactions like suicide rates are increasing in India. So, and another important thing is what post-COVID, there are a lot of studies has been conducted. Depression and anxiety has been going. Bear with my child. Sorry, he promised me that he will not make any problem. Come on, sit, Kavin. Yeah, I wanted to just enjoy the pristine environment, so I brought him. Kavin, be quiet. So, the place I have some interesting slides to show that how your social environment even determines your diabetes status. We know that TB is transmitted. We know that TB is transmitted from one person to another person through, air. If there is one person who is having TB or COVID or something, we are more likely to get that infectious disease. But that is not the case only with infections. Even mental health is affected by the people whom you are surrounded by. Even your diabetes is impacted by the people whom you are surrounded by. That is what we call it as social contagion. It is not the direct contagion, your social contagion. I will go to the subsequent slides. So, we have to give a lot of importance for mental health, especially for our children. We are seeing a lot of violences which is keep on reported. We are seeing a lot of murders. We are seeing a lot of the number of sexual allegations which is coming against the children in India is so shocking. Those are the things, those are the outcomes of our poor mental health status. We always think about punishing the person who has, behaved very wrongly with a child. It is often a relative who is doing the wrong things for the children in our country and everywhere. That cannot be just alleviated just with law and order. We have to focus on the mental health of people. Sexual violence is on rise in India. Substance abuse is on rise in India. Digital addiction is on rise in India because we are not taking care of our mental health. All these violences, all these addictions, all these violent behaviors are a manifestation of an unaddressed mental health things which we have to start addressing at a very initial stage. So where your social environment, your family, your peer environment, the work environment, everything decides how peaceful you are. Unless you have a very understanding, empathetic people near you, we will not be having the peace of mind. Even though we can do meditation, we can practice yoga, but if you think that, if your family members is not cooperating with you, do you think our meditation will help us? No. So that is very important thing, that social environment, social empathy and understanding is very important. Mental health, we have to start prioritizing. This is another important determinant of public health. Then where people work. This is one of my favorite topic. I used to take a lot of classes for the healthcare workers who are working in public health to talk about their health. I am a government servant. I think many of you must be working in government or in some organized sector. We almost spend half of our lifetime in our office. I am right now 43. I will be retiring in 62. On an average, I spend 10 hours in my office every day. And cumulatively, if you take into account all my life years spent in my productive age, more than 50% of my time will be spent in the place where I work. That is more than where I spend with my family. So you actually spend more time with your workplace when compared to your family. But are we giving sufficient importance to our workplace when compared to the family? Not at all. If you ask anyone, just randomly anyone who is working anywhere in an organized sector, do you want to, if I give you a 5 crore rupee, will you resign and come back to your village? 99% will say, I just want to resign and come back to my home. That is the level of stress everyone is undergoing, whether it is IT sector, whether it is government sector or whatever sector. Work-related stress and work-related problems are one of the major causes of morbidity and mortality across the world. Whether it is organized sector, whether it is inorganized sector or whatever sector. Because we have not given sufficient priority for workplace well-being. We think that, you come from your home, you finish your exercise and come. Productivity will not. People focus only on the economic productivity. For example, I have a pressure, how many papers I have to publish, how many grants I have to get, how many patents I have to get. And everyone has a target. A bank employee has a target, a teacher has a target. A railway employee has a target. An informal worker has a target. But no one thinks that the individual health who is working there is important. Productivity cannot be increased. That is why we see the Scandinavian countries, the most developed countries like Sweden and Norway, they have started implementing 4 days work hour, 3 days work hour. They have identified in studies, even if you work for 4 days, that is more productive than 5 or 6 days of working. The number of hours you are working doesn't matter. The motivation and involvement with which you work, that is more important. The reason why we are seeing, it was very tragic, just 2 weeks before, there was a young chap, 23 years old. He just slept, he was a newly joined staff in my NIRT. He went for he went for asleep by 12 o'clock or 1 o'clock. I think by 7 o'clock he was not waking up. When they waked up, he was died of heart attack. Just 23 years. We see lot of youngsters are dying of heart attack. And there is a misperception which says that, COVID vaccine and rest of the thing. There was an autopsy study which was conducted by a forensic doctor in Mumbai. He told that most of the youngsters, previously the age of onset of cardiac problem is 40 or 50. But even with teenagers it is happening. They have multiple attacks which they don't understand. They have multiple blocks. Because the stress level is so high, the food consumption is so different, youngsters are more likely to have cardiac diseases, including hypertension. So the way in which they study, the way in which we work, that impacts our body a lot. You are spending almost 10 hours continuously in our workplace. We don't have the habit of recreation. India has another problem. If you want to study, you study like anything, hell for the exam. Till you get a medical college, don't sleep. When you go for office, we have that colonial mentality. People used to treat us, the foreigners treated us like slaves. That was the colonial outlook. You extract whatever you like. Somehow we have not come out of that mentality. Hard working in the sense when you have to spend the whole life for your job. That is the way we think about job. We don't think about smart job. We don't think about motivation for the employees. We don't think their mental health is very important for productivity. Unless working for 10 hours more stressed is less equal to working for 1 hour with motivation. That cultural shift has not happened. Unfortunately, it is not only in India, most of the countries. So workplace is very important. It is leading to mental problems. The reason why non-communicable diseases are increasing. Chennai is the diabetes capital of India. Chennai is the diabetes capital of India. Almost 20 to 25% we are having. Chennai and Kerala. South states has the highest, diabetes prevalence. The reason is we have controlled all the infectious diseases. Southern states have controlled a very big progress in maternal mortality. Like I told, Kerala has controlled its maternal mortality equal to United States. But their problem is different. We are facing highest diabetes. We are having highest hypertension. Cancer is increasing. When your life expectancy is increasing, you also have all these chronic diseases. And one of the major driver is the workplace, the place where you work, how you work. There is a nice statistic which says that smoking, if you smoke almost 2 packets of cigarette, that will be less harmful than having a continuous stress. Your stress and depression, we think that we may not have alcohol addiction. We may think that we don't have tobacco addiction. But you are just having excess amount of stress and loneliness, that is more harmful than smoking or drinking. The amount of pressure we are getting in our workplace is impacting our heart and our kidney and liver like anything. We are having the highest prevalence of non-fatty liver, non-alcoholic fatty liver. People who drink excess alcohol, they get that fatty liver initially. But we are having an epidemic of non-alcoholic fatty liver these days. Reason is our lifestyle has become such a way that we are identifying more people without alcohol problem with fatty liver. If it is not diagnosed in time, it will lead to liver failure. So that is the reason that workplace is very important for us. And play. Especially as a Chennaiite, I feel that Chennai is one place where we have very less playgrounds when it compared for other cities. And play is not only for children. India will have almost 30 to 40% of the population will be above 60 by 2040 or 50. We will all be grey hair. And we have a very poor understanding of geriatric care. Play doesn't start for children. It is not meant only for children. It is even for old age people. It could be any play. Physical activity is a must. It is a vaccine. The best vaccine in the world is your lifestyle and physical activity. And unfortunately, our real estate is one of the curse for us. We keep on building. We don't give any space. We don't give any space for recreation, even within an office, even within a house. We don't give any space for recreation. Even within our cities, the way we developed our city is so pathetic. We don't have enough space for us to socialize. We don't have, everything has been commercialized. Of course, we can say there are malls are there are food streets are there, but when you go there, you eat more, you harm yourself more. We don't have healthy spaces to play and nurture our good habits. That is one curse actually. At least in our earlier period, even though we are having a poor mortality, we are having very poor mortality indicator, still we had good social spaces in the villages, at least to play around. So this play is something which we have to take it, physical activity is something which we have to take. So these are the four constructs, where you play, where you live, where you love, all these things determine how your health will be. Without understanding all these things, no one could be healthy. Invariably, you will be affected by your physical environment, your social environment, and where you walk. Whether you like it or not, you will be impacted. Unless you are a billionaire, unless you are a millionaire, unless you have sufficient power in hand, you are in a very higher position. As a common citizen, all these 3 or 4 constructs which I told you will affect you irrespective of your age or sex or your occupation status or your language status or whatever it is. We have to start understanding our health from the prism of where we work, live and love. That is very important. That culture we have to inculcate for the next generation. Otherwise they will be falling very sick, I am saying. So this is one beautiful study. Since I am a researcher, this was a study which was conducted in United States. It is a cohort of some, thousands of people who have been followed for 32 years. They call it as Birmingham Heart Study. It is a very famous study. The only study where they have followed the same cohort, same people for more than 35 years. And then they track the, heart-related problems and obesity-related problems. Birmingham Heart Study. So there they understood it is a small closed county. You call it Birmingham as a county. It is like a village or a ward. Where they map every other connection. They monitor their health status. They monitor their lifestyle habits. They monitor their food style. They monitor how frequently they interact. They monitor who are all their friends. Each and every one has been given a very nice data points. So this is a structure which they have identified after 32 years of follow-up. They found that a person's chance of becoming obese increased by 57% if he or she had a friend who became obese in a given interval. That is the crux. It is a gold standard study. It is not an anecdotal something which has been done. Your chance increases by 57% if you have a very close friend who is obese. It is a reality. That is called a social contagion, we say. If you look into this, these are all the patients, these are all the community members they have followed. So the yellow, the yellow is something, the yellow notes are something who have a BMI of more than 30. You see the clustering of this. If you see the green and yellow, you will see a lot of clustering of yellows and greens separately. People naturally, if you look into one person, you may always say, yeah, I know, I have my father, my brother, everyone is obese, I am not obese. Those are individual cases. Public health relies on data which is observed objectively for a quite long period of time. If you have quite a longitudinal data and then if you take more samples, it will normalize like this. This is called as the social environment I told you, where you live. When you have more people around you who are more obese, then you are more likely to be obese. That is what the yellow dots show. Yellow dots are all high BMI patients. They are living. And this is the way smoking also spreads. This is the way substance abuse also. I have done a similar study among alcoholics in Chennai. I will show you later. Your peer membership is very important, how diseases are communicated. It is not only infectious disease, even diabetes, even violence, even your smoking behavior, even your alcohol behavior. Everything is dependent on your peer structure. This is one classic study. I will share you there is a nice video also. If there is I think there is no internet, not a problem. So we always think that infection is the only one spreading, we need to be safe. It is not infection. Your mental health, your chronic health, everything is determined by the social environment which you are living. That is the thing which we are understanding increasingly in these days of post-pandemic era. So I will just give you some important, interesting points about public health. So this gentleman is called as Dr. John Snow. He should be, said as the father of public health or epidemiology. He lived in London in 1820s. He was the one who gave an idea about, what is meant by epidemiology. You must be knowing what is meant by epidemiology. I think some might have known about it. Epidemiology is understanding how diseases spread. That is the foundation of public health. How diseases spread, how it affects the population, for what duration and what frequency a disease is affecting a community. That thing was actually founded by this gentleman. He is the cornerstone of epidemiology. So in London, those days when even London and everything was like our country, cholera was epidemic. Cholera was spreading everywhere. No one, at the time when no one has identified what is called as microbiology. No one has an understanding that Vibrio cholerae is the one which causes. There were multiple theories, why cholera is spreading, hygienic. No one understood that there is a small germ in the water which is spreading. So this gentleman, this is a famous, pipeline. He did a small survey where these cholera cases are occurring. And then he mapped that most of the cases are occurring around, the locality which is near the water pump which was located in that particular area. These days we have GPS, these days we have everything. This is almost some 250 years ago. He took the pain to statistically map that. There were a cluster of cases of cholera which is occurring near that, locality. He doesn't know what is causing, but he understood there is something in this pump which is causing the cholera disease. He came for understanding. This must be the cause. So this is a classic case of how public health works. We don't know about what causes the disease. We don't know about what can cure the disease. But he was able to prevent cholera. He just told, you remove the handle of the pipe for some time. So if you remove, no people drink water from that. Then he saw the decrease of cholera in all the locality. So then he understood there is something contaminated in the water. Just you have to remove the pipe. You don't know what is causing. You don't know what is the medicine. Everything is very vague. But he understood it is something is spreading through this water. He gave an instruction for the municipal body. Just you remove the hand pump. You just remove that, hand. And people were unable to take water from this particular water pump. Then the cases started decreasing. So that is the first classic case of how public health measures has to be implemented. It doesn't need to be injection. It doesn't need to be vaccine. Just educating the people or bringing up some measures in the community which will prevent the disease. That is the beauty of public health. Public health measures are very simple. It doesn't need to be novel. It is not a rocket science. Common sense. Then they decrease the cholera. So this is the classic case of how cholera. And even though I am an Ayush doctor, I always start by addressing my colleagues everywhere where I go. There are two things. There are two things which history has produced in 18th and 19th century, without which most of us or at least half of us will not be alive today. One is vaccine. Second one is antibiotics. Whatever may be the demerits of antibiotics or vaccine, what is the reason we have reached the life expectancy of 69 to 80, the reason we are able to eliminate some of the most monstrous disease from the community is due to vaccination and antibiotics. The best thing is smallpox. You could see, there are few diseases which was leading to the millions and millions of death in the history. One is smallpox, tuberculosis, plague, cholera. Smallpox, plague, cholera, tuberculosis. And all these four things were prevented either by vaccination or antibiotics. So smallpox is something which has killed en masse. And then we all know that, vaccination is one of the most important public health measure. Of all the public health interventions in the world so far, the number of life which was saved by vaccination is incomparable. It has saved millions and millions of life. It is a classic case of public health measure. And that is the reason vaccination is provided free of cost. I was talking with Sir also. Science is not just about, if you produce vaccine, that doesn't help everyone. It should be affordable. If you stop free vaccination, there are certain things which you can just imaginately, I will say. If you want to destroy India, imaginately, you don't need a nuclear bomb. if you want to destroy India, you just take 2 or 3 things. You stop free vaccination, you stop free medication for tuberculosis, you stop the public distribution system. For 6 months, you will see millions of deaths happening. Because we are giving them for free. Free vaccination is free. Those who are affordable, they go for private hospital. Every country which has progressed has provided free vaccination. It has provided free medicine for TB. TB is the only disease where everything is given free. And people are given money for taking the medication. And PDS stop. Even though we are not giving free, we are providing in a subsidized way. All the public health measures which are aiming for the collective whole of the society, we always look into equity. That is why, in the initial slide, I forgot to explain that public health has a principle of equity. It should be equally, a public health intervention should be easily accessible for everyone, acceptable for everyone. Vaccine is a classic example. We made the benefit which we are getting through free vaccination is 100 times more than marketing it. So smallpox and polio and whatever vaccination we are giving are a classic example how investing in vaccination, which is the very most cost-effective intervention. So we have eliminated smallpox. This is polio. You must be knowing that during my childhood, I always see 1 or 2 persons in the class who will be affected by polio. You must have seen. But those things have been a long past now. So this is the way they treated polio children in, they will be putting inside, it is a very brutal way of treating before vaccination was invented. This is the way they were treating, and just with vaccination we were able to remove all these things. And misperceptions. Can you see this picture? Can you understand what is this picture is about? This gives a glimpse of where we were and where we are now as a society. That is a picture of a woman who might have died of a infectious disease. It could be plague or TB or something. During or after her death, it could be either way. So a stone has been inserted into her mouth. Because the perception in those days were, if it is a plague or a cholera or TB, they thought that it is spreading through the mouth, those who are alive, if they speak or if they communicate with anyone, the entire village will be affected. That is the reason they just insert that brick into their mouth to prevent the transmission of the disease. Such a brutal way. This was widespread. I think it was from Austria or somewhere European. This is the way we treated infectious diseases. You just insert, that is the most, you burn the woman, which burning was very high in those days, because they may spread the infection. Because we don't understand what is meant by public health, we don't understand that this is not the way to treat infections or public health. So it took almost hundreds and hundreds of years for us to understand that vaccination and antibiotics can cure, cough hygiene can cure, not spitting in the public places will cure, but not inserting the bricks in the mouth will cure anything. It is a very painful thing which we have understood throughout the history. So this is the way, this picture shows what is meant by public health, why it is important. Unfortunately, there is a kind of a notion which is coming that, vaccinations are very bad, antibiotics are very bad. Of course, every medicine will have its own complications. Everything has its own complication. Even if you take excess of dosa or idli, it will have a side effect. It is not only medicines or vaccination, but the cornerstone of public health is vaccination and science. Okay, this picture shows that where we were and where we are now. So there are 2 or 3 points I will give you. One is the lung health is very important thing. For the first time in the history of India, usually the highest mortality in the country is attributed to the cardiac cases. If you take the mortality across India or the globe, the highest mortality is attributed to cardiac conditions. But for the first time, the lung-related deaths have taken the first. From the WHO has reported, the deaths which are caused by lung-related ailments has been exceeding than the cardiac-related ailment. This is a very grave thing which is going to put our entire generation into jeopardy. The way we have destroyed our environment, the way we have destroyed our air quality, that is going to haunt us. The number of death which is caused by this poor lung health is very high. So 1.6 million deaths. TB, we have only quarter of this. TB, we are just having, 2 to 3 lakh deaths, but 1.6 million deaths are attributed to poor lung health. and 18% of global COPD. And unfortunately, our country, yes, I think this you must be knowing, 14 of the top most polluted cities are in India. Delhi is the classic example. So how can we think that doing pranayama or doing some jogging or doing some exercises will prevent us when your surrounding is so bad? Chennai is not so far. We are going to have the same air quality soon. That is the reason we have to start thinking from the public health perspective. These things cannot be reversed in a single day. Jon Snow had the privilege of removing the water pump very simply, but can we have a technique to remove air pollution by removing a pump? No, we are destroying everything. So education and awareness and public health education is very important. Whether it is for children or old age people or whatever it is, we have to take classes for public health for the auto drivers. We have to take for industrialists. We have to take classes for our politicians because it is more important than any other sector. Air pollution is going to kill. First time we are seeing people who are non-smokers, they are having lot of lung cancers. Non-smokers are diagnosed with more lung cancers now, equal to smokers. The reason is pollution. There is statistics which is coming up. Like I told, when the people who don't even drink, they are having fatty liver. Like that, when the non-smoking lung cancer is increasing a lot in Delhi-like places. Because we have left the air pollution to kill us. These are some classic cases. Non-smokers in mid-40s, lung of a 14-year-old boy in Delhi. This is what we are pushing our generation towards. And the only solution is education, advocacy, and self-responsibility. Political things are there. Everything is determined by what the bureaucracy thinks, everything is there. But we should also, as citizens, we should do our part. We have to educate, we have to advocate, we have to change the way we think about public health. The importance which we give for God, we give for spirituality, we give for education, we give for money, the same importance has to be given for public health as well. That should be made a curriculum for everyone. And it is not only, we may think that indoor air pollution is no more a problem. Almost we have electrified, we have gas and everything, but still there are pockets. When I went for Manipur, when you go for tribal settings in rural areas, still indoor air pollution is a big problem. And women are the most sick due to the indoor air pollution, especially women are the one who are affected by the fire breaks. And tobacco use, I think these are common things. Smokeless tobacco is increasing a lot. When compared to smoking tobacco, even though we have made some good, one of the achievement of modern public health initiative in the smoking has been reduced a lot, but it is now reforming into kind of these modern cigarettes without, technology aided cigarettes, and smokeless cigarettes are increasing a lot. I think this is a very common topic. And another problem with the climate change is mosquito. This malaria is one disease where it has been controlled very nicely. There are certain things like dengue, malaria, even TB was under control. But this climate change and the rest other societal things like COVID disruption, they are making these diseases re-emerging. Now we have drug-resistant malaria. The mosquitoes are not controlling for any insecticides. They have been adapted in such a way that nothing is able to control them. Even in TB we had. TB treatment is for only 6 months. We developed a strain called as multi-drug resistant TB. You have to take 24 months treatment for the TB. It will not be controlled by anything. They evolve in such a way, so we have a notion called as re-emerging infectious disease. Whatever has been controlled by our antibiotics, now most of the things are not responding to our antibiotics. We call it as an antimicrobial resistant, it is an apocalypse. Even the simple infection, the sepsis which is caused when a mother is giving birth, that is not getting curable nowadays. The bacteria has become so resistant, the normal medicines which we give is not responding to them, deaths are increasing. So we have this problem. What we thought as once sorted out forever, all these infections are re-emerging in the world. Mosquito is one example. And of course, I kept this importantly. There are two topics which I want, since we are living in Tamil Nadu. I think Sir from police department knows the highest mortality due to road traffic accident happens in Tamil Nadu. Highest mortality due to road traffic accident. And also the highest, maybe the highest, liquor related, alcohol related morbidity and mortality could also be high. We have to see, I don't have data, but I presume that Tamil Nadu will be having very high. So the reason why we are having so much of mortality due to road traffic accident is, it is very simple. People are not responsible, people are not educated. We know that not wearing helmet, We know that over speeding and we know that not wearing a seat belt will cause mortality. It is a very simple thing. Everyone knows. But we are not following. Wearing seat belt and helmets and speeding down will actually reduce lot of mortality. That is, as a behavioral scientist, I always say that awareness is not working. Awareness is different from behavior. People who are drinking in our Tasmak shop, don't they know that alcohol causes problem for them? They know that. In our health psychology, we will say that everyone has an excuse. He will say that my father or my friend was drinking for 20 years. He is not feeling any problem. I am exceptional. Awareness, we try to, whatever information you give you, they will try to bend it in such a way it is convenient for them. He will think that, alcohol may be a problem for rest. It may not be for me. There is another simple excuse. I am not drinking that much. I am not smoking that much. My problem, some people will say, probably I will drink maybe till my marriage. Probably I may drink till my depression goes away. So your awareness still is there. They know that, but we try to postpone. Behavior change is very important. Your awareness doesn't change into behavior. Any behavior, it is driven by our culture, it is driven by our instincts, it is driven by the people, your peer support. That is the reason I saw that social contacts are very important. If you want to change an alcoholic person, you don't need to give advice to them. If you give advice and change his friends, he will be changed. Rather than giving advice to him, if you give his alcoholic companion and then you give him money, 10,000 rupees each, you don't drink with that guy for next 1 month, automatically sobriety will come. Behavior change is impacted more by peer. So where we have to invest on behavior is how to change the environment, how to inculcate messages in a culturally appropriate way. Just speaking alone will not change. So that is one good example how we can prevent this, seatbelt related thing and alcohol thing. And this is another important thing. Just, with this example, I will conclude. Violence. This is a data from California. You know that the United States has the highest gun violence. Even we saw 2 or 3 days before one big guy was shot down. We don't have good data, so I am presenting a US data. So this is the gunshot violence which was got, almost 1.3 lakh, gunshot victims. So if you look into the victims, the red color thing, again you see like the obesity like prevalence, Wherever the gunshots are happening, the victims, they are clustered. It is usually in the black neighborhood. The reason is the same social contagion. It also is applicable for not only for gun violence, it is also for domestic violence, it is also for substance abuse, it is also for all kind of violence. It is all social contagion. The environment, the social environment you live that determines the spread of violence. This is one of the classic study. How gun violence spread through social contagion. Violence doesn't occur sporadically. It doesn't occur, just randomly. It has a pattern, and that pattern is driven by how our society is organized. And this should not be implied in a very racial manner. It has a mixture of both, white and black and everyone, but the environment in which they live, you see the clustering of gun violence which has happened across that particular district. If you do a similar survey of substance abuse or some other violence here, probably it will have the same pattern here. So unless you address this entire environment, you will not be able to put the gun violence in hold, or you will not be able to put the suicidal or substance abuse in hold. So this is another one classic case, and I will show, this is the study which we done in Chennai. TB, alcohol use among TB patients. We just took, TB comes more among the alcoholic patients in North Chennai. So where we identified, these are yellow spots are the, Tasmak shop where these people have been congregating. And then, so these are, gray area is the one, those who have TB as well as alcohol problem. We saw that a lot of clustering was happening. People who are drinking in 3 or 4 groups, they were more probable to get the TB due to the transmission. They sit and drink, they exchange the glasses, they socialize for more than 2 or 3 hours together. That is the reason you will see TB is endemic in North Chennai. Within a single apartment, you will have clusters of cases. Within a single ward, you will have clusters of cases. They will have 3 generations of TB or 2 generations of TB. Not because it is genetic. They have such a social circumstance. it repeatedly comes. But that is not the case here. So your social, and this is our study which we published, how peer networks are influencing alcohol behavior. So this is, I think this you have to give to your children, related to mental health. I will share the PPT. This is an adapted questionnaire. This mental health problem or digital addiction is becoming a major issue among our children as well as our, general population. Out of these 4 questions, I think I will read out. Have you ever felt you need to cut down on your smartphone use? Have people annoyed you by criticizing your smartphone use? Have you ever felt guilty about using smartphone? Have you ever felt you needed a smartphone first thing in the morning to study yourself or feel normal? Does anyone has this experience out of these 4 questions?
Yes. There has been criticism of overuse.
Yeah. Have anyone had felt guilty about using cell phone? So if you have 2, if you have 1, yes, then you are fine. If you have 2, then you have digital addiction. So this should be given. This should be given for our children. And this is something very important. Digital addiction, it is a very, very leading cause of mental stress and anxiety as well as loss of productivity and lot of cognitive impairment for the children. This is a wider phenomenon. All these things are not restricted for 1 or 2 people. It is a very wider phenomenon which is affecting across the country. There is going to be a very strong public health measure to cut down this. I think even some countries like, European countries have started cutting down use of cell phones, even for education purposes. So this is one area where public health interventions are needed. So, so these are some thoughts. So I talked about, where to live, where to work, where to love, all those concepts. I have given you some anecdotal, some examples, good examples about, the history of public health. Cholera we have talked about, smallpox we have talked about. All these examples are information to make us understand that we are no more living in an isolated environment. Post-COVID, we are living in a most COVID has revealed something like I told. Not everyone is safe. Not anyone is safe unless everyone is safe. We cannot isolate ourselves because the environmental and the social factors are impacting more and more us, and our generation will be in a peril. My son's generation, in those who are living in 2040s and 50s, they will have a very difficult time unless we take public health as a very serious thing. Individual well-being, it is outdated. Public health well-being will be the mandatory thing. It will be the driving force of our individual well-being in the future. So I thank everyone for giving this opportunity to talk about this important topic. I am very happy to answer your questions. Thank you.
Any questions? Sir, you said that if you are with certain people with certain like in case you said obese something. So is there any study which shows the reverse?
These kind of studies are very rare. So reverse in the sense if they are healthy.
So the obese will, if a depressed person is with a happy person, the depressed person loses depression.
Yeah. So, we always, that is one problem right now, all our studies are, basically studying the deceased people. We have not come for the healthy people. So these are rare kind of studies. Maybe I will search and give you. But the meaning of the study is when you are, it is an inverse also. If you are more likely to get obese, then it says that you are less likely to be obese when you have a non-obese person. That is the reverse implication.
Okay.
Yeah.
Longevity is independent.
Yeah.
But as the quality of life, which is very, very important.
Yeah.
It's not only the length,
Yeah.
but the quality of life has improved or not. One can live long, but with poor quality of life.
Yeah.
So that it requires a solution, isn't it?
Yeah. So, from a society, so quality of life is something which we have started talking about these days, But as a society, India is, I think still India is a developing country. We are a resource poor country still now. Longevity is a universally accepted thing. It is a bare minimum thing. If you are having a very poor maternal mortality and infant mortality and your longevity is, life expectancy is poor, then the basic requirements of your life are not met. That is what is meant to be. Maybe quality of life, for example, there are countries who have already achieved, like I told, Japan is there, you have Denmark is there, Netherlands is there, where they have sufficient resources, where they talk about not only about longevity. I think France has people, Japan has people, those who are living more than 100 years, they have crossed 1 lakh people are there in Japan. 1 lakh people have crossed more than 100 years. France is also having, Italy is having. So those kind of society, they have a privilege of talking about quality of life. Still, I think we should move to quality of life, but 69 is still a poor thing when compared to Western countries. We should be having at least on par with the 80. And when I say 69, it is not throughout India. There may be regional differences. India is such a diverse country. You cannot compare the life expectancy of Kerala with Uttar Pradesh, or you cannot compare with Assam or something. So at a bare minimum, we have to, at a national level, we should be able to improve our life expectancy more, and quality of life equally, I understand, sir. But the first step, which should be that, life expectancy. That, yeah, that is an emerging problem. Not only Scandinavian countries, we are also facing the problem. Even China and India, we have a window period up to 2040 or 45. Then I told most of the productive age group would have gone to the middle ages. I think we have followed a wrong population control approach. Now everyone is feeling, even China is feeling the heat. Both India and China, they have a window period of next 20 or 30 years. Then most of our population will be the old age population. We will be missing the engaged population. Even Russia is facing that. Wherever we have implemented this aggressive population control, we are facing.
No, it's not aggressive. Scandinavian countries have not followed an aggressive population control.
Yeah.
But the society itself is involved where the question, why have children? They are a nuisance.
Yeah. Yeah.
So with that, you have a very, very, not only declining population in the sense, and if the trend continues, we may not have
So not only even the European countries, whole of the Europe has the fertility rate, replacement rate has fallen to 1 or 1.1. It is the problem throughout the developed world. And we will be having that problem in the next 20 or 30 years. So this population, I think overall we have not, so that is the Malthusian theory, what we say that, the scarcity theory. We have enough wealth in the world, but we always keep on blaming the population. That was introduced during the colonial times. People are poor because they breed a lot. They have a lot of people. We don't have enough resources. That scarcity mentality has developed a kind of a, fertility control thing which is resulting now. But now everyone is realizing population is the wealth. When you have more working age population, when you have a healthy population which is long living, nothing like that. That is the reason that we see that, now even politicians have started thinking in South India, hey, you start having more children. China is speaking, Russia is actually providing incentives for school children to get. They are providing, if you give birth to at least 4 or 5 children, everywhere there is a crisis. In 21st century, we have understood the only wealth is healthy population. Everything is secondary. It is a global phenomenon, sir. It is not only in Scandinavia, all the European countries are facing, we are also facing. When I talked with there was a meeting with the State Health Department, they told the number of lonely, parents who are living in southern states, especially in Tamil Nadu, is very high. Lonely parents, they don't have, the children are well settled, they are abroad, everywhere. So this is becoming an issue in southern states especially, which are developed on the lonely parents are very high. There is no caretaker for them. And so only Tamil Nadu has introduced that, home-based care for these old age people they have started. It is going to be a major problem. We will be having the working age problem very less in the next 20 or 25 years, unless we do something drastically. Yeah.
Okay, so
public counseling.
Counseling, sir?
Counseling centers.
No, sir. When it comes for mental health, still it is the least priority. So during COVID time, they started some helplines, telephonic counseling or something. But when it comes for public infrastructure for counseling and psychosocial support, India is very poor. We have very less psychiatrists. Seats are very low and interested people are very low. Even when you go for private sector, there are two aspects. We don't have We have like courses like, clinical psychology, therapeutic psychology, everything is coming up, but the numbers are very low. On the other hand, the society has a problem. Mental health, still it is considered a stigma. No one openly says that I feel I am depressed, I want a therapy. How many of your children will openly say, hey, I am depressed, I just want to see a counselor or therapy? It is considered as something as a wrong thing in our society. Approach towards mental health. Can a woman in a rural, for example, there is a rural village, a newly married woman, she is having a postmarital depression. Can she say to her, mother-in-law, I want a depression counselor? Is it possible in our society? She will be thrown out. We have to think, women are the one who are facing the utmost stress and anxiety and mental health problems. Most of them are living in low middle class or in rural areas. Can they openly talk to their husband saying, hey, I want a therapist? Can I go and speak with a therapist? No. It is a taboo still now. Yeah.
The major have taken some instrument to put in body and they change the vibrations. When you are depressed, the vibrations are different. And when you are using that thing, the vibrations, they harmonize. And depression goes like this. Some counselings are there in public.
So for mental health, the main thing, human touch and human contact, one-to-one counseling is the best. Even telephonic counseling, I will not suggest. One-to-one counseling. And family support is more important. You may meet the counselor maybe 1 month in a once. But your caregiver, your family member is the one who is always with you. Sensitizing your caregiver and family member, how to deal with the person is more important.
They are giving like wristwatch.
Okay.
Something to tie. And
so technology, there are some benefits, sir. For example, you can monitor your, maybe there will be a time you can monitor your mood swings using your Apple Watch or something. But nothing can replace the human component when it comes for mental health. You should have a human component as well as you may have a technology component. I think we have a population of 1.3 billion. We need a huge investment in mental health professionals. We have to incentivize, and then we have to have a strong school health, mental health program. Within the schools, we have to inculcate all these practices. We have to train the teachers in counseling. So all these things are, that is why this public health is very important. You don't go for individualistic approach. You do something which will be applicable, equitable and approachable for everyone. It benefits all aspects of the society. Then the individual benefits. Maybe these kind of technology, they may be very costly. It cannot be implemented for everyone. But making one teacher as a counselor, that model will work out throughout India. It will be cost effective also. Make one of the senior student as a student counselor. Then it is more easy than wearing all these things. Those kind of things we have to think.
Okay, thank you, Dr. Karikalan ji, and on behalf of Theosophical Society and all the people present here, I would like to extend heartfelt gratitude for you coming here and sharing with us this such important information. Hopefully, and you will share with the PowerPoint with Mr. Ramkumar, so if anybody wants can get this data, because this data reminds us also the state of the people, or we are part of that group. So thank you once again, and as a token of our gratitude, I request Professor Shinde ji to offer some of the books from our So, and thank you for coming here. Thank you everyone for coming on Saturday afternoon. Have a great weekend. See you next month. Yeah.